Can everybody see the screen, the PowerPoint? Okay, excellent. First, I'd like to thank you all for, attending, and also I would like to thank the organizing committee and all those involved for making the conference happen and for allowing me to present my research. I am Dr. May Watson. I'm an assistant professor at the University of Southern Mississippi. I've been a nurse for roughly 13 plus years, and in 2019, I decided to go to nursing academia. So 2020 comes the pandemic, and I encounter my first student who has concerns of suicidal ideation. And so that's what really sparked this research in psychological distress in nursing students. So I just want to start my presentation with a quote that reads, "No visible symptoms, no runny nose, just a head full of darkness. No fever or rash, no fractures or sprains, just a longing for something unable to explain." And what this quote really represents to me is how much psychological distress can be overlooked and how hidden it can be amongst our nursing students. I'm sorry, I'm setting up my timer so that I don't go above 15 minutes. So the research study I did was psychological distress during the COVID-19 pandemic in nursing students. I did a mixed method study. The introduction, so nursing students experience a high level of stress and anxiety throughout their education, and in fact, experience more anxiety than students from any other healthcare discipline. So nursing students are having to balance didactic and clinical courses while simultaneously balancing financial, family, and other life issues. And this has the potential to exacerbate any psychological distress caused by the nursing program alone. So the COVID-19 pandemic has thrown yet another challenge into the mix that the nursing students already face. The rapid shift in the way that clinical courses and online courses were being conducted as a result of the pandemic have then overwhelmed nursing students even further, leading to negative consequences from unknown stressors. Although research is ongoing, there is still limited data of how the pandemic has truly affected nursing students and the long-term effects. So this research is needed to examine and recognize the occurrence of psychological distress and associated stressors among nursing students during such an unusually challenging time. So the purpose of my study was to identify multi-level factors that impact psychological distress in nursing students attending a baccalaureate nursing program during the pandemic. There are so many effects of the pandemic on nursing students that I know that my study will help to uncover some associations that can play an imperative role to the future of nursing education. Nursing is now a different world with handling COVID patients, burnout, staff shortages. So as an educator, I often wonder if I'm appropriately preparing my nursing student for what is to come. I believe that the study can open up avenues to explore what improvements nursing education can make to equip the students to handle this new world in healthcare. In my study, we came up with 3 research questions. So research question 1, so we wanted to know, what is the relationship between the student's social support, coping, COVID-19 stress, COVID-19 anxiety, general health, perceived stress, educational environment, and other demographic factors on psychological distress? Research question 2 is, what are the nursing students' perceptions of those same variables? And then question 3 was, to what extent do students' perceptions of those same variables confirm outcome data on a psychological distress measure? The significance of the study includes knowledge generation and understanding related to contributing factors of psychological distress, environmental stress, and other associated stressors experienced in nursing students during the pandemic. So a growing body of research has documented that psychological distress can have negative implications on academic performance, academic achievement, and as well as college dropout rates. In a study conducted by Eisenberg and colleagues, there was a demonstration of lower grade point average and higher rates of college dropout prior to the degree completion among students who positively screened for psychological distress. And that doesn't even include the COVID-19 factor. Research design. So the research design is a convergent mixed method study. It was deemed most appropriate for addressing the research questions presented. A convergent mixed method study is recommended when comparing different perspectives drawn from both quantitative and qualitative data. So the table depicts the schematic for the convergent mixed methods design. The expected outcome of the convergent mixed methods design is to merge the 2 databases to show how the data converge or diverge. In my quantitative sample, a convenient sample was selected from Southeastern nursing programs in the U.S. So invitations to participate in the study were sent to the nursing students in the following Southeastern states: Inclusion criteria for the quantitative sample was that participants were 18 years of age or older. They were admitted to a nursing program as a BSN student located in one of the Southeastern states. BSN students did not hold any previous nursing license, and RN to BSN students were excluded. We did a power analysis to determine a required minimum sample size of 101 participants. So we were able to determine that a minimum of 101 participants would be used in the study based on the number of dependent and independent variables in the study, and I'll go over that in a later slide. For my recruitment methods included contacting each state's student nurses associations, as well as through social media platforms such as Facebook and Instagram. Directors and deans of BSN programs within the states listed were contacted through the Southern Association of Colleges and Schools, just to obtain some listservs. Other methods included network sampling and advertisements. I did use the announcement in the slide in my recruitment efforts, and quantitative data collection took about 4 weeks. For procedures, the study was submitted and approved through the University of Southern Mississippi's Institutional Review Board. The quantitative survey was administered using Qualtrics, which is an online software and platform to help collect and organize data. And all participants were asked to sign a consent for participation within Qualtrics. And at this point, they could choose to opt out of the survey if they wanted to. Instruments for quantitative data. So the study included 13 independent variables, with psychological distress being the dependent variable. I did develop this table to display the different instruments with corresponding variables and measures. So measurement tools utilize Likert type scales and self-reporting. There are 5 different types of instruments used. So as you can see, there's a total of 33 questions or items, including the demographics. The scores from the Kessler Psychological Distress Scale, which is the K6, was used to determine psychological distress in the participants. So should a participant score a 20 or above on the K6, they were actually considered to likely have mild to moderate mental distress. All participants were given this information on the K6 within the survey and could choose to be contacted for their results by providing an email. Qualitative sample follow-up interview and data collection. So purposeful sampling was used in recruitment for the qualitative sample of the study. Participants who chose to opt in for information on their K6 result and scored a 20 or greater received this announcement in the slide. My target sample was 10 to 15 follow-up interviews conducted via phone, Zoom, which ensured saturation and provided a good sample size. So phone and Zoom interviews were recorded and transcribed verbatim and collected over a 4-week period shortly after quantitative data collection ensued. These are some resources that were attached with my follow-up announcement for any participant who scored a 20 or above on that K6. These resources are from the National Alliance on Mental Illness, so NAMI, and the National Suicide Prevention Lifeline. NAMI provides mental health information specifically for students and also information on crisis services. The announcement also prompted students to reach out to their own university counseling services as needed. It is asking me to admit some people, so I'm going to do that. All right. Follow-up interview questions. So these are the follow-up interview questions. The average time for the interview lasted about 12 minutes, and participants were asked about their experience during the pandemic using these open-ended questions. These questions are associated with some variables. So question 1 is associated with educational environment. Question 2 is associated, as well as question 3 is associated with stress and coping. Question 4 and 5 address anxiety and coping. Question 6 and 7 address social support, and question 8 address overall health. Analysis. So quantitative data was analyzed using IBM SPSS. Means, standard deviations, and Cronbach's alpha were determined for all of those scales. Descriptive statistical analysis, bivariate analysis, multivariate, multiple, linear regression, and binary logistics regression analysis ensued to determine the predictive effect of independent variables on psychological distress. Qualitative data was analyzed using coding and qualitative content analysis to identify overarching themes within the interviews. And then the mixed methods analysis included an enhancing approach, which is an integration strategy for analyzing and interpreting both the quantitative and qualitative data, and then to derive meta inferences or conclusions. Quantitative analysis, so descriptive statistics of the variables included 202 participants that completed the quantitative survey. Most of the participants were Caucasian, female, not working, and single. The average age was 23 years of age, 23 years old. One of the significant findings was that out of 202 participants, 45% of those participants experienced mental distress. This was determined by a score of 20 or greater on the K6. Results from the DREAM scale indicated that about 64% of the participants perceived their educational environment as excellent. And then at the bottom, the perceived stress scale, the PSS-4, was 12.86, which indicated that most participants experienced mild to moderate perceived stress. Quantitative reliability and validity. So all tools were deemed reliable within the study with a Cronbach's alpha of 0.70 or above. So you can see all Cronbach's alphas for each tool listed in the table. We also use single item indicators, which were also deemed reliable in that they have been used in similar studies, which indicated the single item measure as a reliable substitute for multiple item indicators. Quantitative findings. So bivariate analysis determines significant statistical associations between psychological distress and educational environment, marital status, and then perceived stress. Our multivariate multiple linear regression also found statistical associations between psychological distress and educational environment and perceived stress. And then our logistics regression analysis determined significant statistics association and odds ratios for psychological distress and the single item indicators of coping, social support, and COVID-19 stress. Qualitative analysis. So there were 11 participants that were recruited for the qualitative follow-up interviews. All 11 participants consented for participation. Data from the interviews were stored and coded in a categorization matrix within Excel. The matrix sufficiently represented the participants' responses, concept which deemed it trustworthy and valid. And then coding and content analysis was deemed the best approach for analysis. Themes that emerged from qualitative data. So each interview was carefully analyzed and 12 codes resulted from the analysis. And these themes were finances, experience, breaks, time, unknown, support, encouragement, unchanged, communication, transmission, online learning, and workload. For our mixed methods integration results, so integration of qualitative and quantitative data ensued, and 4 major meta inferences were determined. So 1, disruptions in nursing students' educational environments such as online learning, workload, communication, and finance issues can actually increase psychological distress. Social support in nursing students can increase coping, which then decreases psychological distress. 3, nursing students coping such as time management and breaks can decrease stress, leading to decreased psychological distress. And then our last meta inference is that COVID-19 stress, concerns, and isolation in nursing students can actually increase psychological distress. Limitations and delimitations. The study may not generalize other nursing programs from different geographical areas or other programs with more male students. The study may not include such in-depth responses of that of a longitudinal study. And in addition, the study was limited by the honesty and clarity of the participants' responses and on online questionnaires and phone interviews. All right, future research. So based on the results of this study, more research on the long-term effects of the COVID-19 pandemic is needed in not only nursing education, nursing students in BSN programs, but in nursing in general and what that means for our future nursing workforce. So nursing education and faculty are encouraged to identify those students with an increased risk for exposure to multi-level factors as a result of the pandemic, which may lead to risk to their academic success. Knowing the factors of psychological distress in nursing students during the pandemic can help faculty to better prepare nursing students and create an educational environment that accommodates to the new type of patient care delivery that the pandemic has produced. And that actually concludes my presentation. Thank you all again. I just want to ask, let me see if I'm good on time. Chairs, do I have time left for questions if there are any?